I am Dr Saju, Additional Professor of Urology, Kerala. Today I am talking about the status of corona infection in United States of America. We all know it is the most economical power and the country having most sophisticated medical equipments and personnel. But they are severely affected by the present corona infection. And New York, California, New Jersey, etc., are severely affected. And the most economic center, New York, is most heavily affected. The place having a lot of modern hospitals is finding it difficult to accommodate such a large number of patients. America is having around 55,000 corona patients at present and reporting around 750 deaths so far. And New York itself is finding a shortage of ventilators, masks, doctors, nurses, and other drugs and facilities. In the initial stage, America blocked the visas of Chinese tourists, but they did not do the same with European or British citizens. So that led to infection coming from the European passengers, and America did not take early steps to shut down. So when they decided to shut down many states, it was a little late. So why they didn't do it early? Because they have more of economic concerns. They don't want their economy to suffer. They don't want the people to lose jobs. They want their institutions to run. So that's why the delay in shutdown came only late in United States. Now itself, even after 55,000 patients are positive and around 750 deaths, Trump is trying to reopen the industries by next Easter, that is April 12th. So what are the concerns? What are the compelling forces which are leading Trump to think like that? So at present, America is at the top of the economic world. They are afraid that their position as the number one economic giant may be affected by this corona infection. And they fear that China may overtake them in economic fields. Next, internal matters. The economy of the companies, the economy of the individuals, the jobs, and special things like Hollywood, tourists, their exports, everything will be affected. So America, Trump is a pure businessman. More than a politician, Trump is a businessman. So he wants to see that the business is not affected. But unfortunately, it is not the time to think about business. This is the time to think about the health of the citizens, prevent them from being infected, and protect the lives of already infected patients, and prevent other states from peaking the curve. So these are the strategies. So that cannot be done in a few days. That cannot be done in few weeks. It may take a few months. So if the political pressure is there to reopen the industry by April 12th, what Trump is trying to do now, that may produce a big catastrophe in United States. So he's thinking against the medical advice. He's getting the advice from the economic world. He's getting the advice of the Wall Street. He's getting the advice of the Bollywood. They have different concerns, but this is the time to think about the health, the concern of the lives and health of the people. So what India has done, India has 1.3 billion people. Our economy is not as strong as that of United States, and most of the people live by daily wages. They don't have income if they are not working. So even then, India has did the strong step of lockdown. This is the only way we can stop the disease from going to a sharp peak. We are not stopping the disease, we are only stopping the sharp curve and allowing the medical field and allowing the administration to cope up with managing the patients, doing the tests, proper tests, giving time, getting time to isolate, and getting facilities to treat the already infected. So those patients who needs oxygen, we should give them. Those patients who need ventilators, we have to give them. So that's the concern. So if there is a peak, if there are 1,000 patients coming to a hospital, how can the hospital cope with that? It is impossible for any hospital to cope with such a calamity. So what we have done is the right step, and we have to cooperate with that. We should understand that there is no magic. It will not be over in a day or two. Maybe it may take a few weeks more. Maybe up to the end of May it may continue. So we have to bear with it. We have to tolerate it. We have to cooperate with the administration, and by the time we have to be safe, we should see that we don't contract the disease. Thank you.